And then obviously, again, overused term, but patient engagement, the fact that hopefully everyone in your system can touch their healthcare how and when it fits them, right? If you're a millennial versus a baby boomer, you're going to interact differently with your technology and user interface than even if you have the same type 1 diabetes issue. So melding that, so it's not one size fits all, precision UI as well. So then just riffing here a little bit, when you have a patient with an issue, let's say something common like hypertension, they may now be not just with the usual once a day blood pressure device, it might be able to know to watch. There's one coming out from Omron, which might squeeze your wrist, or several startups doing non-invasive, almost radar-based hypertension. So you can have essentially real-time hypertension numbers and use that in a seamless way to tune often 2 or 3 different drug classes. So building in these sort of algorithms and feedback loops that continue to learn and fit into both the prevention side and disease management. So, and that requires good user interface. It requires some smart reimbursement elements. It maybe requires you to have a bit of a digital pharmacopoeia. And there are clinics like Forward and others are trying to build what's the next generation of that primary care visit look like. That's a little bit of what I would think about in terms of building a system from scratch with, on the exponential, not just building it with 2018 in mind. What kind of data elements or platforms or pipes might you need to preserve for what's likely to be here in a couple of years? 5G is rolling out in many cities, including Southern California, within the year. So what could you be doing to be thinking about 5G and 6G? Where could you be building in your platform integrated telehealth, where asynchronous or synchronous care could be used, again, across the care paradigm? So those are a few things I'd be thinking about, and not just with the lens of 2018 as well.
Yeah, so some of the forward-thinking health systems, I think of Geisinger, who says with primary care visits, they're going to start collecting genomic data. The other thing is, I love the quote from their CEO who said, our goal is to eliminate all waiting rooms within the health system. And really what he was talking about is redesigning from, it's design thinking, right? So it's redesigning it from, hey, we designed wait rooms because we designed the entire thing around the physician, and the patients can wait. And we have a limited resource of physicians. And what he's saying is, we're going to redesign it. And it doesn't necessarily mean that you're going to put additional burden on the physician, but you're going to do the design thinking to say, all right, well, how many of these visits, is it 60% of these visits, they don't even need to be in that room at all. And we could just push these back into the home or on the device.